Good afternoon, everybody. Welcome to this session, an international session which is organized by the Process Project, which is meant to help us think on health promotion in sports organizations and in the sports community. There will be 6 presentations in this session. We have French and non-French colleagues who will be addressing you. They'll be telling you about theoretical advances. They'll be telling you the different models we use, but also the tools and interventions that already exist out there in the field. Now, we're going to be looking mainly at 2 questions. 2 questions we'd like to ask you. So we'd like to pick your brains on that. First, is it healthy to do sports in a club? So I'd like people in the room to raise their hand if they think that sports in a club is healthy. Okay, it's quite reassuring about the general vibes for this session. It seems that part of the audience is convinced. Now, we wanted to exchange with you on this, and actually will be the subject matter of the first presentation. The question as to under what conditions is it healthy or unhealthy to do sports. We know that physical activity has a lot of benefits and that sport is a contributor, but we also know that sports clubs can be unhealthy. For example, if you think in terms of alcohol use, smoking, violence or bullying that you may sometimes come across in the sports community. Now, we don't want to have a clear-cut opinion on this. We'd like to debate this with you. We'd like to see how we can think to make sure that this social environment can bring advantages to people and society at large. So we'll be looking at this first question in this conference. A second question for you today. What does your club or your coach do for your health? So if we take the broad definition of health in a holistic, mental, psychological, physical sense, we can ask ourselves how sports organizations support health, how they own this issue and how they do it. So some of the presentations will be looking at existing tools, what can be done, and we'll be looking also at existing challenges. It's really the idea of this session. We want to collect information and try and build solutions to these issues. Now, how are we going to go about this? There will be a first round of 3 presentations, with the first presentation by Susanna Geidne for the Örebro University in Sweden, who's going to set the stage of relationships between sports and health. So what are the relations between sports and health? What are the similarities and differences in these relations? Then a presentation by Benjamin Tézier on the findings of a study into national policies that support health-promoting clubs or sports clubs here in France to define the current policy landscape, to see what sports clubs can do to promote health and how they can engage into different actions. Then a third presentation from Ireland with Colin Regan, who's the head of the Community Action and Health Department at the Gaelic Athletic Association, the GAA, which is a non-governmental organisation, which is the largest sports union in Ireland. Mr. Regan will be telling you about a 10-year programme, or a programme that's been in existence for 10 years. He'll be telling us how they designed this programme and how Colin put together his department and how he's moved from 8 partners to a full-time 7 employee team. We'll also have a presentation by Stephen Whiting from the WHO's European office. He'll be telling you about work we've done together on health-promoting unions or federations and on guidance that we've designed together. Then one last presentation that will be more focused on French clubs with our two colleagues from Santé Publique France, Fabienne Lemonnier and Florence Rostand. They'll be presenting tools and what was at stake in this project, what we've done, and what tools we want to give to sports organizations and public authorities to make progress in this area. And we'll have concluding remarks by Anne Vulmer on the different type of exchanges. Now, without any further ado, I'm going to hand over to Susanna Geidne, who's going to start her presentation.
Good afternoon, everybody. I will present a study that me and my colleagues, among them, Aurélie, are working on just at the moment, actually. You will be the first to hear these results, so congratulations to you. Now I see the pictures too. Good. Yes, we know that the concepts of public health and health promotion have been used for decades in relation to sport in policy, research, and practice. We also know that sport has some kind of significance for and connection to public health, because otherwise we shouldn't be here if we didn't think of that. Working in this sort of crossroads of fields for years, we have started to think on how we can understand these relations between sport and public health. So my aim of this presentation is to argue that what is regarded as knowledge about the relations between sport and public health, it depends on how the concepts of both public health and health promotion, how they are defined, but also how sport is defined, and also how they are framed. So in this presentation, I will theorize a bit, you could say, between these relations between sport and health promotion, because we are identifying some patterns that are visible, both in policy research and practice, about this. So, I said that the definitions was important, and that's why I have to start with the definitions of both health promotion, and sport. If we look at the first definition here, you will probably all recognize it, because it's the old one from 1948, which was a bit criticized lately because of its defining health as a state, something you can be or not be. So in 1991, a little bit updated version of this definition came, saying that health is not a fixed endpoint. It's not a product we can acquire, but rather something ever-changing, always in the process of becoming. So this process is something how we now more look at what health is, something that is changeable. This came 1991, something even more important that came 91 to explain what health actually is the classic model of health determinants, which you probably all have seen. This model shows the unavoidable and the avoidable factors that determines your health. There are lifestyle factors, social conditions, living condition, external living conditions, and we know that all these affect our health, but they also affect each other. For example, participation in physical activity and sports, it's affected by who you are, your family, where you live, where you go to school, which city you live in, and also the norms and the support on national level. And they are all affecting each other. This is important to have in the back of your head when you're going further in this. So what is health promotion? You probably all know that public health stands on two pillars, disease prevention and health promotion, and that both are important in relation to sport. I will focus on the relation between health promotion and sport in this speech. And as you might know, the definition of health promotion is the process of enabling people to increase control over and to improve their health. Also a process. And you have maybe also seen this one that says that health is created and lived by people within the setting of their everyday lives. And this settings-based approach is sort of framing all of the work we have done during the years. So what is sport? That also needs to be defined, because it's also a concept that is used differently by different people, and we need to be aware of that. I found 3 different definitions. Just took them, one from the European Sports Charter, one from the Oxford Language English Dictionary, and one from my own Swedish Sports Confederation. And as you might see in these definitions, they are a little bit different. The first one says it's sport quite broad, both competitive and recreational. The middle one, there's more a competitive version of sports, while in the Swedish one, it doesn't mention competition at all. So if you have those different definitions of sports in your backhead when you talk to people and you have different definitions, it might be a very confusing discussion. So to summarize this shortly, the definition part is that if health is defined as only lifestyle factors, the relationship is sometimes spoken about that sport equals physical activity, and then the discussion is over. In this case, sport is health promoting as long as there is sufficient physical activity. But if we define health in terms of all the determinants of health, more of the core activities can be considered health promoting, but some parts can be seen unhealthy. Looking at a lot of literature, the latest maybe 10, 15, 20 years, at the crossroads of health promotion and sports, we have looked at key aspects like how health promotion and sport is defined, what is taken for granted when they sort of do this research or policy, what is the purpose, actors, and actions in this research or policy, and how the action of promotion actually is described. We have identified 5 different types of relations in this. Those are health promotion as an outcome of sport, let's see, they come in different, So, health promotion through sport, health promotion in sport, health promotion and sport in collaboration, and health promoting sport. And because of how they define health promotion and sport and what they take for granted, these categories are quite different. I will explain them one by one. If we start with health promotion as an outcome of sport, the relation is about sports being beneficial for health since it offers opportunities for physical activity. Research in this field often focus on individual behaviors and the effects on physical health, like lowered risk for various diseases or risk of overweight and so. And because sport is seen as physical activity, it will always lead to better health. Sometimes mental health also. And the relation as we see it is that sports equal physical activity leads to health. And that's sort of taken for granted in this type of research. If we go to the next relation, health promotion through sport, as we call it, sport is regarded as a mean or a vehicle or a tool for outcomes other than sport, sometimes in combination with sport outcomes, but often other outcomes. Here we define sport relatively broad, both competitive and recreational, but they sort of never define health or health promotion at all in this research. They focus on health determinants often on organizational level, like social responsibility, developmental objectives, gender and democracy, and those big parts, which are health determinants, but they almost never mention health in this research. What you take for granted is that sport is used as a mean, assuming that sport is good in itself, for developing different health determinants on social and organizational level. So the relation as we see it becomes sport leads to health, which are mentioned as health determinants. In the third relation, we have called health promotion in sport. This is about sport as a positive place more, or arena to reach different people to promote some healthy behavior. And the place is chosen because it's a relevant context where you can find those people with health messages and deliver them to those people. And the people can be, or actually the activities can be specific activity, but it often is specific programs or interventions. For example, mental health programs or dietary habits interventions. And they are sometimes to the sport participant themselves or sometimes to fans of a football club, for example. And this, in this relation, is using health promotion program within sports to get healthier sports participants. And we say that the relation becomes bring health promotion to sports, and it will lead to health behavior for sport participants. In the fourth relation, we can see health promotion and sport in collaboration. Here it's about sport and health organizations working together. And this intersectoral collaboration could be between organizations, but also different professions or people. And the research in this area often focus on how to manage intersectoral partnership collaboration, and very often how to face the barriers that are always almost seen when there are intersectoral collaboration. What is taken for granted in this is that if sport and health collaborate, more and other people can be reached. So we see the relation as sports and health equals health for all. Then we come to the fifth relation that we have identified. And here it is about how health promotion is integrated within sports. And this is grounded in the settings-based approach, where healthy choice, that we make the healthy choice the easy choice, and we look at all the different layers of organizational in the club or in federations and so on, and we look at organizational, economic, environmental determinants of health. We are integrating health promotion into the core business of sports. And this relation becomes health promotion integrated in sports equals healthier sports. So if we try to conclude this and try to relate those relations to each other, we conclude that there are some similarities and differences. All these relations have an overall vision of promoting health in relation to sports. Everyone thinks that sport is a good mean or place or setting, or otherwise they shouldn't work with this, but they do it very differently. Sometimes they use the same activities for the same people even, but with different purposes and also covered by different surrounding activities. Maybe an activity with a policy and a strategy in the more health promoting sport way, but more a program in a health promotion through way. So it could be same activities, but the differences lies in them answering different questions. Some of them more what is, and some of them more how will we do this. And what we will conclude is that knowledge from these different relations, they can add to the whole picture, but no single relation has answers to the whole question on how health can be promoted to sports. You get evidence from all these different relations that cover the whole puzzle. And why is this knowledge important? Yeah, we have found so many research fields that address the relation between sport and public health. There is in physiology, medicine, public health, psychology, sport management research, sociology, pedagogy, and more. what we have found is that these different research fields don't communicate with each other. It's very seldom that you refer out of your silo. And that can lead to the cumulative production of knowledge about the health promotion potential of sport may suffer because you don't learn from each other on sort of different levels and layers. There are many good efforts being made, but these become separate islands if they're not coordinated at several levels. And I think working with both health promotion and sport is that especially the field of health promotion has the potential to help both with the coordination, but also with the how question, the process of doing something. So that's my input to this. So the take-home message I want to share with you is that sport is not health promoting because it is sport, but it has the potential to be. And we're never done making sport health promoting. It's really an iterative process in a changing world. Everything is changing all the time. You can't just, yep, there we were done. Now it's health promoting. So you constantly need to work with this. And it's not enough that we as professionals know that physical activity and sport are good for people's physical health for sport to be health promoting. We have to use a more inclusive conceptualization of how health can be promoted in collaboration, or as health promoting sport to make the health promoting an outcome of sport. And as I said, this is the first time we present this, and it will be a chapter in a coming handbook of concepts in health, health behavior, and environmental health. Which I don't know when it will come out. I know that we will submit our chapter next week. So it's hopefully within 6 months or something. So if you want to know more in-depth thoughts about this, I recommend this chapter. So thank you for listening.
Thanks very much, Susanna. Thanks for clarifying and setting the stage for our reflection on how health is related to sports and what we're gonna see in the symposium is about. Okay, how do these relationships are really framed into the sports system and what are the assumptions of different programs and interventions? The next speakers, le prochain présentateur, c'est Benjamin.
The next speaker will be Benjamin Tésir, who will present the result of a study that we set up to analyze the national policies for the promotion of physical activity that would support health within sports clubs. This is done worldwide, and that will be presented based on the works of the process team. I'll go back to French because my English is no good. The slides are in English, but I will speak in French. Thanks for being here. I will talk about a project that we led with the process team. That's the fruit of a partnership between the Lorraine, Côte d'Azur, Santé Publique France, and the minister in charge of sports and Olympic and Paralympic Games. As said by Aurélie earlier on, we are going to talk about the study conducted to examine health promoting sports clubs national audit tour. So, sports clubs are recognized as venue to contribute to the personal health of individuals. 15 million of people, of club members, have their health promoted when being in a sports club. When we practice sport, we have the opportunity to go down. When we go to a sports club, we can also face sponsors related to alcohol. We also can face gender harassment or bullying because of our origins. So, policymakers and researchers recognize that the club can contribute to health promotion, and they insist for a setting-based approach to application. And this is why they encourage to have an adaptation. This is based on a cycle. What we should retain is that it does not depend on our behavior alone, but also our behavior, our interaction with the others, our interactions within communities and organizations, but also the influence that policymakers can have on the international level on our health levels. And so we have a lifestyle approach, because this can actually apply to hospitals, to schools, and this was conceptualized at the level of the sports club, because any kind of club member can have their health influenced by health determinants, and decision makers, policy makers, club directors can have an impact, and all the actors of public health and sports clubs and so on can have an influence and should think about their impact. They have an influence and then can assist sports club in having health enhancing physical activity promotion. And we can see that we have gaps on the matter in terms of knowledge. So political support is essential, because we talk about health in all policies. We also know that national public policy, and they guide the choice of sports clubs and sports federations at the national level. And so if we influence them, they will influence. If we influence sports federations, they will influence sports clubs. So we can also have a top-down approach. And what we saw in Europe is everywhere the same. Only 26% of European countries have a sports clubs for health implementation program. So the target of our program is to pinpoint and analyze national French public policies supporting health promotion in sports organizations. We tried to look for the public policy documents that would support health promotion in clubs, first of all. And the second method was to have interviews with key information officers, sources of information, to see what mechanisms exist for coordinating, evaluating, disseminating, and implementing these policies. So we looked on the websites to find documents of political and public health authorities, from Santé Publique ministries. We looked for national plans, strategies, roadmaps, decrees, and programs to talk about sports clubs, sports federations, and their connection with health promotion. As for interviews that would have a template as to the questions to being asked, we had documents identified, 11 key informants were identified, and we identified who to question, which stakeholders are involved, how to communicate around these policies, how they are implemented, and so on and so forth. So there are several criteria that I just mentioned, and these criteria were outlined in this manual that you see here on the screen that help assess health enhancing promotion measures and policies, and they are disseminated throughout Europe. So we identified 14 policy documents, 85 political actions among these documents that would talk directly or indirectly about the promotion of health through sports. Directly because the club would be mentioned as a target, or because it was mentioned as a partner of other organizations such as schools, for instance. We also see that these policies are supported by government agencies or national health organizations such as the ANS, CDOS, and so on, CNOSF. And we also looked for promotional and communication campaigns and education. And then the topics that are targeted concern physical activity for health purposes as a global concept, but it's quite, it's not very precise, but they also tackle gender equality and disability in sport. When we tried to review all this documentation, we could see the axis number 3, better protect the health and sports people and improve the safety in sporting activities, whatever their intensity, like anything related to alcohol, to sport and health. And all these documents are mainly related to Pillar 3, as said, to better protect the health of sports people and to improve the safety of sporting activities, whatever the intensity. As for the content of these policies and actions, what the interviews allowed us to understand is that there's not really a coordination between the decision makers and the policy makers and the sports clubs. Some would suggest that one ministry should draft a text that would guide the policies and measures looking forward. The main target is not clubs, but rather sports federations, that then they would in turn implement the policies with sports clubs. And what we saw, that the role of regional and local bodies is crucial to the implementation of these policies. This is something that is done slowly but surely, but the implementation would be rather at the local and regional level. As for means of communication and implementation, it is, as said earlier, it is important to have devolution in our way of, in our SOP. We should have decentralized actors, organization, national bodies that will use the website, the brochures, the leaflets and guides, and we should have training and certification. Okay, I repeat myself, but national bodies tend to develop those policies rather than local authorities. As to policy evaluation and follow-up, what we're being told by the key informants is that there's not a lot of measurement of evaluations. So we don't know what's going on the field. Sometimes we manage to assess them, and we have people that manage to give us information, but there are no KPIs as to how these policies are being implemented. And then, as well, some other factors that could influence policy implementation, that's the use of national events. Olympic Games are very much drawn upon to implement policies, to convey messages. We also have the conviction that partnerships are important for sports federations and sport clubs, not only in terms of public health and sports movements, but also with academics, to create synergy between the policymakers and implementation of said policies. As sports stakeholder, may it be a federation or sports club, we should not rely upon a single sports policy, but rather try to look for a package of projects, if we can do so, because there's no coordination. There are three key messages that should be takeaway messages. There are several actions that are being mentioned in these policies and in these documents. However, does not necessarily mean that we have the necessary coordination among the stakeholders to implement the policies. The second thing that we saw, that we realized, is that often health promotion is seen as something inherent in sports activity and not as something to develop. So it's not a key focus for policymakers. And what we also realized is that in terms of text implementation, of law implementation, the health-enhancing physical activity promotion do not allow us, are principally dedicated to other settings than organized sport itself, such as school or others. We don't see beyond. We're not trying to create an organization or an environment that would be health-enhancing. So, to wrap up, first idea is to see what are the common points what do we have in common with other European countries? The first idea is that we find a diversity of stakeholders and of stakeholders and promoters of such health policies within the sports environment. We have a policy that is focused on this participation in sport that would be beneficial to health. This is what was said earlier. Sports participation in its practice is actually health conducive. We also see that there's a lack of coordination among lawmakers, decision makers. As to France, more specifically, we think that it's automatically a healthy practice, but it's not always the case. And what is also very specific to France, something which is quite good, but we need to extend. It's the way in which we approach physical activity, because we often see that physical activity is only for health purposes, and we forget about adjustment to some age groups and vulnerable groups. Then the use of the tool that I mentioned earlier, it's quite interesting because it enabled us to pinpoint some criteria, to make some analysis, and to put forward some margin for improvement, which is quite tangible in terms of coordination, follow-up, and assessment of political measures that are being implemented. Thank you. You have a QR code that will enable you to have access to the process website if you want to give it a go. Thank you. Thank you, Benjamin. Thank you for this presentation that allows us to see what's the state of play as to the policies that are being implemented, to have a systematic vision of what is going on in terms of club support. Before having a Q&A session, we should wrap up this first part with Cole Riggin, who's the head of the department, everything that is community and health within sports. Within the Gaelic Athletic Association, you have the floor.
Bonjour, je ferai ma présentation en anglais.
Hello, this presentation will be in English because my French is awful, says the speaker.
I'm the Community and Health Manager with the GAA. Has anybody here heard of the GAA, the Gaelic Athletic Association? 2 hands. 3, and 2 of them have been my guests in Ireland. Somebody down the back. We have 30 Gaelic Athletic Association clubs in France. When the Irish go abroad, we take 2 things. We take our pubs and we take our games and culture. So I will give you a little overview of what the association is all about. Can you check the clicker, please? Yeah, very good. So we pride ourselves on being a community organization as much as a sporting organization. We were established in 1884 around the time of the codification of many sports, and with the precise intention of promoting Irish culture, language, and our national games. The work that we do in the area of health promotion very much speaks to our side as a community organization. And maybe to give you an indication of just how significant that is, this is a picture of every GAA club in Ireland. So we have potentially a health promotion team in every single community. The clubs are recognized as a hub for all activity in their community, much beyond the sporting life of our members. For example, during the pandemic in May 2020, when social isolation for older members was imposed across the country, our members responded, driven largely by the clubs that were initially in the Healthy Club programme, which I'm going to speak to. They started delivering essential groceries, medicines, fuel, etc., for the older members of their community that were forced to isolate. So by 3 weeks into the pandemic, 20,000 GAA volunteers were delivering essential goods to 35,000 people over the age of 70 who were not allowed to leave their own homes. The government actually used the framework that the GAA had put in place to try to augment their own response to the COVID emergency. As you can see, there is a significant network internationally now. As well as the 1,616 clubs in Ireland, we have almost 500 clubs internationally right across the globe. We also have two sister associations, the Ladies Gaelic Football Association and the Camogie Association, founded in 1974 and 1904, respectively. We are in the middle of an integration process for the three associations, which is long overdue, but is also of such a significance to the Irish population and to the country and to our society that a former president of the country, Mary McAleese, has been recruited to chair that process. And that there gives, again, an indication, we think, of this, just where the Gaelic Athletic Association, the GAA, sits in the Irish psyche. I'll give you a little flavour now of what the games are. There was supposed to be some audio with this here, but the audio isn't working. So if you can just think of your favourite rock song and have it playing in your head as this is going, I think it should work okay. So we're a completely amateur sport. None of our players receive any payment. We have the fourth largest stadium in Europe, Croke Park. 83,400 is the capacity. So the players that play there on a Sunday or a Saturday, on a Monday, they're the teachers, the nurses, the doctors, the policemen, etc., out in their communities. So there's an immediate accessibility to those potential role models. They are the elite players who represent their counties. There's 32 counties in Ireland. I was fortunate enough to represent my county for 15 years. But at grassroots level, the club level, you must play for where you were born. There is no transfer system unless you move away from where you were born to study or to work, and then you can apply to play for a new club or county. It's a full contact sport, as you can see. I probably would be a useful case study for another conference sometimes in terms of both the health enhancing potential and also the health damaging potential of the sport, because in the last 10 years I've had a knee construction, I've had back surgery, and that is as a result of probably playing a little longer than I should have. But on the flip side, I also experienced many health enhancing possibilities and potential, particularly around identity and a sense of purpose. And I think that's the two fundamental things that every human being looks for in their life, is the opportunity to feel that they belong and the opportunity to contribute to something that is bigger than themselves. And that at a core is what we feel the association is all about, and the potential of sport generally. So in the middle of the noughties, Ireland was in the midst of a significant economic boom. And as a result, there was a significant increase in consumption of alcohol across the country. The health service executive turned to the GAA to see if we could be part of a response to that. And we implemented a substance use alcohol and prevention program through our club network. Fast forward to 2010, 2011, post the economic crash, the topic of conversation on most people's tongues were, as well as financial stress, was the mental stress that came along with this. So again, we started to sit down with the Public Health Agency in Ireland, or the Health Service Executive, the HSE, to explore how we could expand our work in the area of substance use into a more holistic health promotion intervention through our club network. We spent 2 years working with academic experts in the field to try to devise a model that could be implemented across our clubs. And as I said, I'm not an academic myself, I'm a practitioner. I came from the playing experience. And I see very much my role as being something like a referee between the academics and the practitioners, telling the academics, giving them a red card sometimes that will just not work, or letting the play flow. And we worked with a very small group of 16 clubs to try and test this here model and to see essentially how it works when the theory translated to practice and the rubber hit the road. Over the course of the 18-month pilot, or phase 1, as we call it, because in Ireland anyway, every pilot is doomed to succeed because this gets so much support and energy, and then afterwards it tends to be somewhat forgotten about. We participated in an independent evaluation with Dr. Aoife Lane from Waterford Technical University, which strongly endorsed the model as a realistic tool to implement health promotion based on the World Health Organization's settings approach to health promotion, which looks at the places where we live, work and play, and try to make those a healthier place for the participants to enjoy. And looking at Susanna's presentation, I think we probably touch on all 5 areas that you have identified there in terms of how we implement. So over the last 10 years, the program has had a significant impact, not just on the participants within it, but also the association as a whole. At the start, we experienced quite a lot of resistance. The question was, why are we going to allocate vital volunteer resources to an area that the government and the health service should be championing and delivering? Our argument was very much bringing it back to the values of the association and our community identity value, and supporting the intention of our clubs to deliver more than just players, to deliver better people. Over the last 10 years, that conversation has evolved from why are we doing this to how do we do it better, and now very much what is the impact that it is having. I will take you through now a piece of research that we just concluded last year, a social return on investment evaluation of the Healthy Club program. We have now grown from those initial 16 clubs to just over 600 clubs participating. So that is over 1/3 of all the clubs in Ireland. We have just started to branch out to our international units, and we have about 10 of our international units that are trialling the model at the moment. There's a lot of nuances because each one of them has to speak to the structures and the culture within the countries that they exist, but it should be an interesting journey. So it required the establishment of a new volunteer within the Gaelic Athletic Association, a healthy club officer. And that there individual comes from a very wide array of backgrounds. Significantly for what was traditionally a very male-dominated organization, excessively male-dominated organization, it has provided an excellent pathway into our volunteer structures and our officer roles for female leaders. But a lot of them the vast majority are the parents of children who are involved in their club, and they did not, 1/3 had never had a volunteer role in their local sport GA club before. But they saw themselves, while they did not initially see themselves as becoming a club chairperson or a secretary or even a coach, they saw themselves as wanting to make the club a healthier place for their children to enjoy. That individual receives, when the clubs must apply to participate, on average we have between 150 and 200 applications every 2 years. Once the successful applicants are brought on board, and part of the onboarding is we deliver a 90-minute general health promotion for sports education opportunity for the volunteers, the Healthy Club officers that are going to drive this. We asked them to identify at least 3 others in their club, depending on the club size, that is going to be part of a project team to deliver this here. They undertake a club mapping to identify what their club is already doing well. So do they have a substance use policy in place? Do they have a healthy eating policy in place? Are they doing outreach to community groups? Are they making their facilities available for older members of the community for social nights, etc., etc.? They undertake a community mapping to try to identify, are there clear gaps of services that exist within their particular community that the club can work towards filling or provide access for other partners to come in. They then commit to an action plan that must be delivered over an 18-month period with reporting every 6 months through an online portal to check their evidence of action and delivery. And then we work with them to communicate, and this is a really big part of it, just letting their members and their communities know what they're doing and celebrating that success as volunteers. We have identified that as really significant, that the volunteers are getting recognition and the club is getting recognition for going above and beyond what would be expected of your traditional sports club. And then, as I said, at the end of the 18 months, we review their online portal, and clubs then are officially recognised as a healthy club, not just by the association, but also by Healthy Ireland, which is a cross-departmental body within the government. So they also give the club their stamp of approval as being a health-enhancing club. So this is essentially the framework that the volunteers work through to guide them on their journey. As I said, they develop the plan that is based on local need, and then we try to ensure that we have developed off-the-shelf interventions that speak to national government policy and are evidence-based, that support the club on the delivery and implementation, so they don't have to waste valuable time trying to come up with, if we want to do a physical activity intervention, what should we do? We say, well, here is what has worked in other clubs. This is what we recommend. It's really important that the club identifies the suitable partners. And this here is both partners that are within their club as potential volunteers or external, be it statutory bodies, NGOs, charities that have greater capacity and resources to deliver around particular health promotion areas than busy volunteers in the sports club have. As I said, they determine the activities they're going to roll out, and then they record the impact that it has on their club, both in terms of the social and cultural, as well as the physical impacts. These tend to be the 6 most common areas that clubs have identified that they work on: mental fitness or mental health, diversity and inclusion, healthy eating, physical activity and social Gaelic games, community development, and substance use and gambling. It has driven very positive change within the association as well. In 2019, as an organisation, we prohibited the use of any gambling sponsorship within Gaelic games. We also do not accept any alcohol sponsorship at a national and elite level. However, our clubs at grassroots level are permitted to work with local licensed premises, for example. The clubs can strive towards the basic foundation, which is a requirement for any healthy club, or they can progress through additional criteria to receive silver or gold accreditation as well. As part of the social return on investment evaluation, and we use the international best practice model developed by the UK Foundry and for what they do to assess the social impact and determine funding across the likes of NGOs in the UK. Some of the significant findings on volunteers, and this here for us was very significant. The volunteers who were delivering the Healthy Club programme actually reported greater gains than the participants themselves. Now, they were coming from a very high base because volunteers tend to have a higher level of self-reported well-being anyway. But for a long time, if you're familiar with the 5 ways of well-being, giving back is one of the significant ways that we can all support our own health and well-being. And this here reinforces that volunteering and giving back is physically good for your health and emotionally and socially good for your health. They delivered, as you can see, over 100,000 hours in Phase 5 alone. That's when there was 447 clubs involved, and that there amounted to the equivalent of 1.1 million euros using the Irish minimum wage. So their contribution was significant, but their gains that they made themselves was 3 times that. For a club and an association, our motto is where we all belong. So for us to be able to go back to our senior management and committee and say to them, the Healthy Club programme has significantly moved our clubs on the dial that consider themselves and that their members consider inclusive and welcoming, was great justification for us to maintain this here important work. In terms of the impact on clubs, volunteering in any sporting organisation is a major challenge. I'm not sure the landscape in France, but post-pandemic in Ireland, there has been a significant drop in sports volunteering. 10,000 of the participants in the Healthy Club programme over the 18-month period had no previous involvement with the GAA. So we were really welcoming in the wider community, whom we completely depend on for fundraising, etc. 38,000 participants were only closely connected previously, but 77 participants went on to have some other elevated involvement in their local GAA club. That could be joining the club, volunteering, taking part, or attending matches. For some of the participants themselves then, the impact on the physical health, 40% recorded that they had adopted healthier behaviours, while between 10 and 25% were doing more physical activity since they took part. I don't have time to present a second video here, but one of the biggest physical activity interventions that we undertake, it's so simple in its concept. Ireland is still a largely rural country if you move outside Dublin. And during the winter months, physical activity drops off a cliff because it's dark, it's wet, and there's poor physical infrastructure. For an 8-week period during January and February, we encourage our clubs, when there isn't a significant activity, our Gaelic Games programme starts up largely towards the end of February. But they open up their club houses and their club grounds, turn on their floodlights, and they welcome their communities to come in and walk together as a community and enjoy not just the physical benefits of that activity, but also the social benefits of being able to meet one's neighbour in an increasingly dislocated world and have a conversation with them when we tend to sit inside and turn on the telly and pull the curtains over those nights instead. It has turned into Ireland's largest physical activity intervention. It's activating approximately 60,000 people walking each week, and we're currently engaging in a longitudinal study to see, again with Waterford Technical University, to explore the impacts and learnings that can be taken from it. During the pandemic, when they couldn't gather collectively, we worked with our funding partner, Irish Life, as you see, is the named partner for the Irish Life GAA Healthy Club programme, who developed an app so individuals could track their own steps. In the most recent, it has continued post-pandemic, and again, we are activating approximately 40,000 participants over the 5-week period of this year's STEPS intervention as well. So, in terms of the overall satisfaction and why we're planning to continue to do this, our aspiration is that every GAA club, all 2,000 plus GAA clubs, become accredited and certified as a healthy club. 85% of respondents to the survey that we participated in pre and post Phase 5 said that they would like to see their club expand this type of activities, and 97% would recommend the activities to others, friends and family, and others in their community. We know that loneliness is becoming one of the major social health concerns of a modern world, and again, 51% of respondents had made new friends through the community, and 17% had taken up a hobby or activity that they had continued beyond the intervention period offered by their club. So when we speak to our funders, we receive 140,000 per annum from the Health Service Executive to support the delivery of this here programme. And then, as I said, Irish Life, they're a major pensions organisation in Ireland, the major pension organisation in Ireland. They have been supporting us for 7 years now to the tune of about 1.3 million. Obviously, we need to present evidence of impact back to our funders to ensure that it continues and that the weight of the delivery, financial weight, is not entirely placed on the Gaelic Athletic Association. So the headline figure from the report was that we were generating 50 million worth of savings for the Irish society as a general, in general, but specifically attached to the Health Service Executive. And to their own investment of 140,000, they're getting a 4-to-1 return on every euro they invest, which is quite significant. Thank you very much.
Thanks very much, Colin. It was really interesting to see how you go from the why to the how to the what impact, and also to see the journey of starting with 16 clubs and now having 600 implicated. So yeah, thanks for that, and I think it's great inspiration. Je vais demander à la salle.
I will now ask the room and online if you have any questions for our three speakers, Susanna, Colin, or Benjamin. Or if you have questions online.
Yes, I have a question for you, Colin. What is the weight of culture in the example you gave about GII? Because it seems that you have a specific sport and then with a strong. How do you interpret that? Is it transferable to another country with such a strong sport, or?
It's a question we're working with. Sport Ireland is our overarching federation in Ireland for all sports bodies, and they are the funding body for all national governing bodies. And they're currently engaging with the other sports, particularly what we call the big three, which is soccer, rugby, and ourselves, to explore the transferability of the Healthy Club programme. There is absolutely unique elements to the Gaelic Athletic Association, and the primary one in terms of the health enhancing setting is that the people come to our clubhouse not just to play sport, they come there for so many other aspects of their community life, and it's hard to quantify that. From the work that we've been doing across some of the European Sports Clubs for Health network, that is definitely particular dynamic to the GAA that wasn't able to be quantified as part of the most recent study.
Yeah, so you said that they are coming for other stuff than sport, but does it mean that you have less other way to welcome these people in the community for social activities, for example, or how you?
It's a dual-edged sword. I think our greatest strength can be our greatest weakness because it is so tied up with Irish identity that an increasingly multicultural Ireland, we know that some of our new migrant populations feel that, we're not familiar with that game and we're not Irish enough to play those games, which we are actively trying to challenge and ensure that we provide pathways for those from some of the minority groups that are increasing in population across Ireland now. But I think on a whole, the strength will outweigh that because we have a strong presence in the school network across the country also, and we are introducing them to Gaelic games in the school setting and trying to provide a pathway across into the club, which should, in the long run, provide greater social cohesion for the minority groups as well.
S'il y a d'autres questions dans la salle?
Do we have any questions where there's no question online? There's no question. I had one for Susanna.
Benjamin mentioned that most of the policy in France are probably focused on promoting physical activity, enhancing physical activity through sports. So what does it mean in terms of your presentation and the different relationships that you show us?
I think that's very visible that many fields just take evidence from one field, and we should not stop at evidence from one single relation, that we should also include and take evidence from the other relations, because some of the other relations could add different or actually valuable knowledge to how, because as I said in the end, that it's not enough that we know that physical activity in sport is good. We need to know how to actually promote it in different ways. And also, as Colin said, with sort of top down and bottom up and see the club's needs and so on. Both Benjamin and Colin mentioned that. So use evidence from more fields, I would say.
I would say to be flexible enough with that evidence to adapt it to your own particular setting.
Because that's the way that you actually have the top down and bottom up, and you actually adapt it to. Because if it's not useful for that context or those people, it won't be used.
Colin, would you mind adding on how you made relationships and how do you advocate with policymakers in Ireland, so in comparison to what you heard from Benjamin's presentation?
Ireland is a very small country, so we know where the politicians live. No, that is an advantage of Ireland. It is a very immediate country, but there is it's a challenge. That's the same as Benjamin pointed out. There are a litany of policy documents that identify sport as an important contributor or enabler or implementer, but there are not the same follow-throughs on funding or partnership management around how those are translated from policy to practice. At the moment, we are struggling. Post-pandemic, Ireland made a major investment in health promotion officers across the country. 190 were recruited, which for Ireland is a very significant resource. But at the present, they're not engaging with the incredible opportunities that the sports settings can offer them. So we're having those conversations at the moment around how we can open up the sports setting to that new army of health promotion officers.
Thanks very much. Une dernière question à Benjamin.
Last question to Benjamin. You were talking about the support from the Ministry for Sports on the one hand and the Ministry for Health. You mentioned other sectors. Can you say more about their contribution, their input, and what we found in documents and what we could imagine finding if sports clubs could promote health looking forward? I can't remember what there was amidst the actions that were promoted, but there are actions related to other governments that are not in the field of health. We find also actions related to the Ministry of Education, Transport, and so on and so forth. And I think there were some keys for answers, as Colin and Susanna said. If we coordinate all these actions from all these sectors, if we create bridges, then we could be more efficient in terms of health, and we could reinforce the place of sports clubs within society and foster new life environments. It came from sports and health and public health, but also from the environment, the Ministry for Environment, for Education. The underpinning idea is that health is not only related to physical activity, but it can have an impact on other factors. And if we combine all these factors, this is how we become efficient.
Your first question to me, Aurélie, the importance of identifying mutually beneficial KPIs, as Benjamin was saying.
KPIs?
Yeah. Yes.
Fully?
Key performance indicators. So, an example, Ireland wants to become tobacco-free by 2025, and we have opportunity. We are working to ensure that all our clubs at the moment are moving towards smoke-free and vape-free campuses. I think that might already be the case in France. Not sure, but there is many public health outcomes that will benefit the sporting club membership, and if they can be mutually agreed and identified, and then a collective plan put in place to implement them, then I think that is one of the first steps that needs to happen.
Thanks. Mathieu?
Merci beaucoup.
Thank you for all these inputs. I will speak in French, I'm sorry. I have a lot of questions, but I will ask a question to Colin to go back to congratulations, first of all, for your achievements. The GAA club, how would you define it? As a sports club or as a quality life venue? Do you have problems with opening hours? Because sports clubs could have opening hours from 6 o'clock to 7 o'clock in the evening, and they will not have the opportunity to promote health issues. That's the first question to Colin, and I will have many others if I have the opportunity to do so.
fine. And the GA club, is it a sports club? Is it a community club? Or is it something else? So that's the first question.
Depends on who you talk to.
Take the mic.
The more traditionalist will say it is a sports club. The parents will say it is a youth development organization. The players will say it's a sports club. The senior management now are increasingly recognizing it as a hybrid between a sport and community organization. So I think it's important to have that flexibility in an organization of 650,000 members. And that will allow us to speak to certain audiences in different ways. One of the progressions from the Healthy Club has been we are implementing a Green Club sustainability program now based on the Healthy Club model. And it has already accelerated far beyond the Healthy Club because immediately the more traditionalists who are running the local grassroots clubs see that they can save money if they become more environmentally attuned to energy usage, to waste removal, to water usage. So in the space that it took us to get to 60 clubs with the Healthy Club, the Green Clubs has now gone to 200 clubs because it speaks more clearly to different needs. There are also those with, particularly our younger members, who are really lifting the baton and the torch for the sustainability because it's such a part of their identity. They want to see their clubs in their communities being a driver of the green agenda. So they're not doing it because it's financially prudent for their club, but they're doing it because it's a much bigger part of their identity. The older the officers executive who run the club are doing it because it's helping them financially. So I think we need to be able to speak to our different audiences for their different needs. Does that make sense?
And then the second part of the question was about the infrastructure. The second part about the infrastructure, because I know Irish clubs do own the infrastructure, but that's not the case in France, so the most rented to the municipality. Yeah. So, and that's makes the situation a little bit specific. Yes. So could you elaborate a bit on that? Yeah,
we almost exclusively own our physical infrastructure, the 1,600 clubs. So we are probably, after the Catholic Church, or maybe ahead of them now, the biggest property owner in the country. It's all vested in trustees. So we have autonomy over what we do within our own clubs. But we are a completely democratic organization run through an annual congress each year with voting structures that allow every 650 members to have a say. So when we made the move, for example, to ban gambling sponsorship, that received a 94% vote at our congress that year. In terms of the structures that support the Irish Life Healthy Clubs programme, as I said, we introduced a new officer at grassroots level in the club. But above that, we go club, county, province, national. We also introduced a completely new structure at county level, and Aurélie did some research into how that scaffolds the delivery of the Healthy Club. It is essential that each element of a sporting organisation, we have found, has a champion, or preferably more than one, but a champion and a structure at each level that ensures that it can pass freely through the administrative structures of the sports organisation.
Thanks. Je sais pas s'il y a encore une question.
Do we have any other questions? Thank you. I would like to pick up on what was said and try to create a connection with our process structure. If I understood well, you work all together, has there been any reflection as to, within this process approach, to see what works abroad, because we have our specific features, we have our own culture, we have our own commitments, but there are also recommendations to rely upon what is done elsewhere. I represent a multi-sport federation, for instance. Maybe it's easier to talk about health promotion or to talk about health determinants, because we're quite general in our approach. We have structures. We'll talk with social workers, with neighborhood community centers, with youth and sport and multi-sport centers. That's a small question as to the process approach. What is your vision in France? Maybe we should talk to the colleagues from the Sports Directorate and the Ministry for Sport as well. Maybe I allow myself to answer. The process is at several stages of the rocket, if we may, in terms of research and development. So with Susanna, we co-manage at the PI Europe, that's led by the Ministry of Europe. We have a 50-member club as to the promotion of physical activity, so there's always work to do. We work with academics on research, on modeling, on theories, and so on. And then beyond that, we co-built the process intervention, and we started working, and we drew upon the work done by Colin, and I spent time in Ireland to see what they were implementing, and we drew upon an Australian good sports program that works everywhere in Australia. So we tried to look for scientific evidence, but also what exists and already works abroad. And the third approach, because the context is important, we wanted to ask ourselves what is specific to France, what are the needs of sports clubs to promote health. We identified 35 ideas that we thought would be important. We also encountered weak clubs. Everything is on the website if you want to know further. That would already support projects like this.
Donc ce travail-là, on l'a fait. Et puis là, sur l'intervention, on est en
and to see what they would generate in terms of benefits. This is where Colin started with a dozen of clubs. They are pioneers, and we work with them to see how we can improve our work. I'm not going to spoil everything, but there are things that work well, that are online already, and there are other areas where we are doing some flagship programs, pioneer programs, to see if it works. But we have input from the international and local levels.
There will be two presentations, Q&A and concluding remarks. So I'd like to ask Stephen Widening from the WHO, the European Office of the WHO, to come here to present the creation and use of health-promoting guidance for sports federations. So I'm going to hand the floor over to Stephen now.
Merci beaucoup, and bonne soirée. This is about as much French language that I have, but my name is Stephen Widening. I'm a technical officer for NCDs, working for the WHO Regional Office for Europe, and I'm going to present a tool that we have developed in collaboration with Aurélie and actually many of the colleagues here on how to provide on guidance for health sports federations to promote health. National sports federations promote health. So as an overview of my talk, I'll give some background. I think many of the colleagues have already addressed the context. We know that sports clubs are a key setting for health promotion. So I'll just go through an introduction to the health promoting sports federation implementation guidance and the model of the health promoting sports club that we're aiming towards. So just briefly about myself, I work for the WHO Regional Office for Europe within the Special Initiative on NCDs and Innovation. This is a new division within WHO that was established about 1 year ago. They have a dual track approach to promoting or supporting the 53 member states of the WHO European region to prevent and control NCDs. So the race to the finish is the more immediate actions that can be implemented to support countries to progress towards the Sustainable Development Goals, especially the SDG target 3.4, which is to reduce premature mortality from NCDs by 30% by 2030. So we've tried to identify the quickest of the best buys. The best buys are the effective and cost-effective interventions that the evidence indicates will be effective in reducing NCDs. And Vision 2050, the second track of the strategy, is more around achieving the long-term actions, progressing towards a Europe that's resilient to NCDs, carbon neutral, secure at peace. So sports clubs sports sector has a very important role to play in this Vision 2050 approach. So one of the main risk factors for NCDs, cardiovascular diseases, diabetes, stroke, cancer. Physical inactivity is one of the main risk factors, one of the 4 main risk factors for NCDs. And within the EU, around 1 in 3 adults are not meeting the recommended levels for physical activity to protect and promote their health. And for children and adolescents, the data shows that it's actually much higher, like around 80% of adolescents are not meeting the WHO guidelines for physical activity. Physical inactivity has a socioeconomic burden. We recently collaborated with the OECD to estimate this socioeconomic burden of insufficient physical activity on health and health systems. And we found that around 10,000 premature deaths per year could be avoided if people were more physically active, which would equate to around 8 billion euros per year within the EU by people being more physically active. WHO has also developed the physical activity guidelines, so how, based on evidence, how much physical activity people need to protect their health. A minimum of 150 minutes per year of moderate to vigorous physical activity, with additional benefits up to 300 minutes per week. And obviously sports and exercise are an important factor in promoting people being more physically active and meeting the physical activity guidelines. We've also developed a global action plan to support populations and individuals to achieve those guidelines with strategic objectives, including promoting access to opportunities, program services across multiple settings, such as sports setting, and systems strengthening the governance and partnerships for coordinated policy implementation. So national sports federations have an important role there. And within the EU, we are conducting a policy monitoring exercise, collaborating with the European Commission. This is these 23 indicators based on a comprehensive national approach to physical activity policy implementation, and 4 of these are specifically based on or around the sports sector. And we can see from the policy monitoring that we've done in the EU that there is a lot more that needs to be done to promote physical activity through the sports sector. But sports, as we've heard from the colleagues, not just about physical activity. WHO has a global sport for health program with 7 pillars: physical activity and health promotion, but also promoting healthy diets, ensuring that mass gatherings like the upcoming Olympics are health promotive, minimizing the promotion of alcohol and tobacco use, and ensuring that the promotion of mental health and active mobility are a part of health promotion in the sports sector. These can have many benefits, for example, physical activity, mental health. On the other hand, there are many negative aspects through marketing unhealthy products, alcohol, tobacco, and I think, as we heard explained very well from Susanna, the benefits of health promoting sports clubs. There's benefits for the sports clubs themselves, managers, coaches, and the participants, and there's also broader benefits of promoting health through sports clubs. So that was just a quick overview of the context, the rationale. I think the colleagues have already explained it very well, why this needs to be, health needs to be promoted through sports clubs. So WHO has developed this guidance. It's available now online, and the French translation will be available in a few weeks. And I'll show this QR code again at the end of the slide, at the end of the presentation. So the aim of this guidance is to support national sports federations to promote health, to provide guidance and tools, how they can implement a whole systems approach to health promotion, utilize governance and partnerships, and increase their role and societal role and commitment to health promotion efforts. And for WHO, one of our key roles is to translate research into practical policy actions in support of our member states. So this guidance is based on a lot of very solid research and academic work from some of the colleagues here and the Process Research Group. So we developed this guide to try to translate this into very practical steps and guidance for national sports federations to implement. So there's 4 chapters of the guidance. The first is the theoretical background with a summary of the evidence and the academic work that underpins many of the recommendations, some case studies and examples, including Colin's example from the Irish Gaelic Athletic Association and an example from Australia can be used for inspiration and to get ideas for other national sports federations, some strategies and interventions to implement those strategies, and some specific tools that can be used practical tools that can be implemented to achieve those or implement those strategies. So the theoretical background is based on the principles of the Ottawa Charter. This is the Ottawa Charter outlined the principles of health promotion. I think Susanna explained this quite well, actually, so I won't go into detail. The second chapter includes some of the case studies that I mentioned, some of the analysis that was conducted of information that was available online, and some example projects to provide some guide on the implementation steps based on real experience, and then the intervention framework. So these are the 13 strategy areas, and then interventions within each of those strategies include some information on the benefits of each intervention, how they can be implemented, and the role that different stakeholders can play. And then the fourth chapter, specific tools to support implementation of these strategies and interventions, with a description of for each tool, the objectives, the content, the population targeted, and the type of tool, and how they link to the strategy of health promoting sports and the Örebro Charter. So this can be used or accessed through, depending on the current status of the National Sports Federation. You can go and look at the case studies, start with the academic work, go and look at the tools immediately. There's different ways to access the tool. And this is the end goal, to progress towards a health promoting sports club. It's going to require support from the national level, public health agencies, national sports federations, down to sports coaches, managers, individuals. And the guidance also includes a monitoring framework and indicators to monitor progress of implementing the health promoting sports club for the national sports federations across organizational, so whether they have policies, guidelines in place, environments, promoting of health, economic investment in physical activity and sports clubs, and health promotion through sports clubs have been established. So just to acknowledge all of the colleagues that developed this guidance, and very much appreciated all the work, Process Research Group, Aurélie, and the Happy Europe Group, and all the individuals here. So thank you very much, and the QR code is available there if you want to download. Thank you.
Thanks very much, Steve, for the presentation, and thank you. I think we can already announce the next one that is coming up soon. So every year we have worked on a different guidelines. So 2 years ago we worked on the national audit tool that you saw that Benjamin presented. So we worked last year on the sports federation, and the next one that's going to be out next year will be on coaches. So the idea is to help the World Organization and work together in terms of providing evidence, but also, as Steve mentioned, linking practice to research and research to practice in terms of health promotion in sports. Thank you very much. Thanks, Steve. Je vais me permettre de présenter donc les...
Now I will introduce the last two speakers for this session, which are two colleagues from Santé Publique France who are going to present in a more specific manner the different things that are being put in place for the scheme. So Mrs. Lemonnier and Mrs. Rostand, Fabienne Lemonnier and Florence Rostand. Well, you have already heard a lot about process. I was tasked with explaining to you what it was all about, but I will not explain it a third time. You have all understood that this project was quite one of a kind in a way, because they are people that are experts in health promotion. We are experts, but also they are researchers, because we are not researchers, and that was maybe what stood out from other run-of-the-mill projects like this one. There are tools that we have presented to you already, but maybe it will be something a déjà vu for you. But on this slide, you can see the logo of our project with some of our partners on this project. So the University of Lorraine, the Université Côte d'Azur, Santé Publique France, but also the Ministry for Sports and the Organization Committee for the Olympic and Paralympic Games. Stephen just mentioned federations. We addressed sports clubs at first because it's a life environment that would be conducive to promoting health. Why have we chosen these venues for health promoting purposes? Because it welcomes a wide variety of population groups, all social groups, coming from different social levels and ladders, and that can have an influence on people to improve their well-being and health. There are all types of athletes from different age groups, different socioeconomic characteristics. It's based on volunteering. It's not for profit organizations. It has a high educational potential. When we talk about coaches, trainers, there are different titles, especially when they work with the youth. They have an educational role, and that's important to promote health and to induce behavioral change. As for sports activity, if you have not heard it once, you may have heard it 10 times, and I will add and top up to everything that was said. Sport is good for physical, mental, and social health. It's important to say it again and again. And promotion of health amongst clubs showed its benefits amongst the members' health. And this is actually supported by literature. And now I will give the floor to my colleague who's going to talk about several things, especially she's going to talk about a book. Thank you. So now I will continue. We have already mentioned several things again earlier on in English, but I will mention them now in French. So why is the sports club a privileged venue for health promotion? Well, because it helps to put in place an approach that brings together all the club's projects that contribute to health, not just those centered on a particular health behavior or a theme. The other aspect which is important is to involve all club stakeholders, participants, parents, coaches, managers, volunteers, because the club welcomes young people, but also parents, and they need to be involved in actions and decision-making processes related to health promotion. There's not only the in-house actors and stakeholders, but there are also external partners and stakeholders, local stakeholders, among others. What was mentioned also, that it's important to be aware that promoting health is a continuous and cumulative process. But also another aspect which is important, we need to base our actions on the specific needs of the sports club, its stakeholders, but also based on the local context. So the actions in one sports club will not necessarily be the same ones in another sports club. That's exactly what Fabienne said earlier on. It has been proved that this approach, the promotion of health among sports clubs, has a positive impact on the health of all the club's members. And when we talk about health, we talk about physical health, but also mental health, psychological health, and so on. You've heard earlier on that a lot of facts have been found as to the role played by the sports club. If the club factors in all the issues relating to health and is interested in the health of its members, it will have a role, but also the role of the club will be higher, the performance will be higher. It can have an impact on coaches as well, because they will be much more motivated to commit themselves, to involve themselves. There's also an impact on the social and mental health of the coaches that will increase also their skills, not only their tactical skills. And also, as a trickle-down effect, it has an impact on practitioners. We talked about the different health behavioral patterns. It seems obvious, but if they practice sport within a club, they would practice more than if they practice sport in an unsupervised manner. So we should help sports in this process approach. We decided to draft a book. Why? A MOOC. I'm sorry, a MOOC, not a book. Because it's important to attract skills and knowledge to gather it in one single place. And that allows managers and coaches to have access to information. We co-built it with several actors, several stakeholders that have a wide array of skills in this field. We have presented the model of the health promoting sports club. There are 4 levels that are inside a club and 3 other levels that are external to the club. So it was important to have a representation of all these levels, all these layers for the drafting of this MOOC, a co-construction process. To get into the nitty-gritty of this subject, let's talk about the MOOC. It's 4 sessions, 3 hours of work, 12 hours in total. And you can see that there are 4 main parts, one dedicated to the process advocacy, then one on the partners that we need to request to implement this approach, and then the implementation of all the strategies. Beyond this, beyond these 4 weeks, we need to raise awareness among coaches and clubs managers. So there are videos, there are also testimonies coming from sports clubs, also case studies that aim to represent and showcase the theoretical knowledge. There's also a forum, as for any MOOC, so that the learners can discuss together. This MOOC was sponsored by the Minister for Sport. It started in November 2021. This is the 4th session now. We've had 6,200 people that registered, and it is available on the MOOC platform. The next session should take place in November, and you can register as soon as September if you wish to. Okay? It was important for us to assess this MOOC because it was the first time that we would address sports clubs as to health promotion issues, and we wanted to know how to know their feedback, basically. And to do so, we relied upon the RE-AIM framework that measures 5 dimensions that you can see on the screen: the range, the scope, the efficiency in terms of the acquired knowledge, the adoption as to the motivations, the implementation, and the maintenance, that's the long-term use. As to the first session, we have drafted a questionnaire so that when people arrive on the MOOC for the first week, we have a questionnaire, a first questionnaire, and then we have an exit questionnaire. Amongst the 2,814 that were registered, 502 completed the questionnaire, the kickoff questionnaire. The average is 41 years of age, 50% men, 50% women, 72% were in a club with 175 members. 30% of them were those that followed the MOOC. Basically, they were coaches or trainers, 21% were managers, and 23% were health professionals in a broad sense of the term. In terms of efficiency, we took an interest in those that responded to the kickoff and the exit questionnaires. So we managed to have 72 participants that completed both questionnaires. We saw an increase of 42% in their knowledge score. which is quite significant, and 6% increase in their self-confidence in implementing health promotion actions. Satisfaction, 93% of learners were satisfied, and as for the long-term use, 47% thought that they could fully apply what they had learned, and 24% that they could apply partially what they learned during the MOOC. This is part of a more global package because we know that it is not enough. We have a 9-stage program, and for those that would be interested, this is the generic address for the process contact resource. So if you want to contact us, you can contact us this way. And I will now give the floor back to my colleague. Oh, wow, I have the right slide on. Great, thank you. So, the MOOC, indeed, is the biggest tool that has been developed for this project. It relies upon many other tools that have been developed throughout time. The first one of which is the diagnosis tool that you can see on the screen. It is important to have a state of play of what the club is already doing, may it be physical activity, health promotion activities, to fight against doping, against alcohol, for protection against injuries, but also social inclusion, mental health activities, all related, everything related to mental health and self-esteem, and with the different stakeholders and partners. So that tool allows the club that wants to launch that approach to have a state of play and to understand and realize, as Mr. Jourdain said earlier, that they already do health promotion without knowing it. And it is important to be aware of it and to organize their actions and to go further down the line. I don't know if the software works. I would like to launch this. No, we have no mouse, so we'll have no video because I don't know how to use that. Doesn't work, does it? Oh well. So you can look for yourselves this small video and you will see that it is important for a club to be aware of the partners that they can call and contact to have an action if they want to trigger that type of health promoting approach. And these are the partners that are listed at different levels. You have a generally presentation of resources, policies, but also partners that may be called upon at the local, regional, but also national level. You take the pyramid as you wish, upwards, downwards, but it's a pity I can't launch it, but I hope that it will have triggered your interest and that you'll be curious enough to look and see. We won't dwell upon this tool because you've seen it already. It was introduced by Benjamin and Stefan. Just a few words. These tools have been drafted by the working group that Stefan introduced earlier, and the French translation was done by Santé Publique France. And here I would like to thank our colleague Chloé Chester, who has spent a lot of time with us on this, because it was not easy. It was not always easy, but we're quite satisfied ultimately to have these two guides available to the French general public. But it's not over. Why? Because our colleagues don't want to stop here in their endeavors. So what is being prepared right now is a specific module of the MOOC addressed to coaches and trainers. Aurélie has said it. There's a guide being drafted I don't know where they stand. It's an ongoing process. Will we have finished the MOOC before the guide? Hopefully. Let's cross fingers. Anyway, I'm finished presenting to you all the tools, but it was, of course, a bit difficult without being able to click on the links, but you have a QR code that will enable you to have access to the website. You also have the website address on the slide and the email address where you can send all your questions, all your inquiries for further information. Do not hesitate to do so. And I thank you for your attention.
Merci beaucoup, Fabienne et Florence, pour la
Thank you, Fabienne and Florence, for this presentation of these tools. What I would like to suggest is that Steve would join us, and I will open the floor for a Q&A. Do you have questions? Yes? Hello? It's a bit frustrating or even disappointing as to the 2000 to have only 72 people answering the questionnaire when we actually send it to so many people. I'm a coordinator in health pathways, and I face the same difficulties when I want to ask clubs to answer questionnaires to know what they do, with whom. I'm working on obesity, so it's overweight issues that I'm tackling. So how do you see the future looking ahead? How do you how do you think we could improve health promotion in an inclusive manner? Well, as to the difficulty that you raised earlier, as to how to mobilize sports clubs, we have to be aware that most of them are volunteers. Coaches, managers, they dedicate their time and expertise on a volunteer basis after their working hours. So it's hard to ask them for more. I have listened to what has been said by the GAA contact person, namely the idea that there's actually a contact person within each sports club. And I think it's really good, because it's important to have someone who feels really involved and who should be the contact person for any time that type of question is being asked. I'll give the floor to my colleague to answer, to follow up on this. Maybe not to pick up, but rather to give another insight. We actually have research and development together combined. For the MOOC, for instance, we have 6,200 participants. We see that there's a lot of enthusiasm, but if we want to assess it for research purposes, we don't have access to identifiers. We need to have an external questionnaire. They have to click, they have to consent to participating. So the number of stages, everything that is needed for this research tool requires an investment that is much bigger from the grassroots agents, and that can lead to that type of outcome, maybe a low respondent rate. So it is difficult because this doesn't enable us to substantiate and to have a robust study. In other cases, this is very difficult. Priority should be given to have development before research, because we need it to be useful.
chercheurs sont pas toujours conscients, et donc il faut.
Researchers are not always aware of that, and we need to be able to make the difference between the two. We need to do the research, then test it, and this is what Colin had as an approach. And we can see how we can assess it in terms of research, and then to capitalize upon it and to see how we can assess that.
Je ne sais pas s'il y a d'autres questions.
Are there any other questions?
C'est parti, un peu plus pratico-pratique. Je vois pas de questions. Oui.
Animé. Merci beaucoup.
Thank you very much. Yes, a more practical question about the diagnosis support. Is it done after the MOOC process or is it beforehand once people have signed up? I just wanted to find out more about the timeline. Right. Here's the thing. For us, the MOOC is a first awareness raising stage. It's not really an implementation stage. It's more about understanding people's approach, their vision. Yet it's a very important stage. It helps us know whether we can accept the vision and get going. Then, as regards this first stage on the vision, it's quite similar to what you usually see in interventions. It's all about identifying someone in a club who will take the MOOC course either with us as part of a crash course or for a longer period of time. And then in the support phase, we have this. So we have the training course, then we have the assessment or diagnosis, and we try to identify 2 initiatives or actions for the following year that will be jointly designed with us. And then comes the implementation stage and then the stock take of these activities. And it's all based on the club's needs. So it's really support for each club. So we work to develop these tools. We have an online platform whereby we can monitor or do some follow-up work with clubs, and we also have one-to-one or face-to-face meetings. And there's a second thing that we work on in which we got really involved last year. We tried to train people and we tried to raise awareness amongst, let's say, second-line individuals, for example, in terms of health promotion. For example, county or department sports federations or unions. And for next year, we want to offer a training course for these second-line people. We're doing this at the moment with the Maison de Sport Santé. It's a health and sports center, but we want to expand this on a larger scale because we don't really have the legitimacy to work with these players. And our knowledge comes from the research community. So it's all about transferring these skills to the front line, but also to second line players so they can expand on this knowledge.
Merci beaucoup, c'était très intéressant.
Thank you very much. It was really interesting. I do have a question actually about the MOOC and the target audiences. You said that some of the courses went well beyond the original courses. Have you thought of sports science students, STAPS in French? Yes. Well, we do this work as part of the Lorraine University. And this MOOC is available to the C3D, which is the Conference of Sports Studies Higher Education Directors. But now, if other universities are interested in this, to disseminate this amongst their students, that would be interested. So, anyone interested, from the man on the street, Joe Bloggs, to sports entities, we gladly welcome them. That was the idea of this initiative. So that's off mic. Sorry, I can't translate. The gentleman needs to speak into the mic, I'm afraid. Okay, sorry. Question off mic. So we thought of them. So our work is limited to recreational and organized sport. Maybe we could try and replicate the results to elite sport. Maybe we could also replicate this to other sports environments, like, for example, gyms. But it's not the primary target of what we have developed, mainly due to the specificities of volunteering, the specificities of clubs, etc. But Fabienne is going to expand on this. Yes. For us, the club is a social venue, just like a school, like health promoting schools. It's also something very interesting in terms of topics. Then it's not the same organization. You're not talking about the same professionals It's not the same environment. It's not the same infrastructures and buildings. So our MOOC and all our tools target rather people who come to a sports club. For example, mothers who take their kids to football practice, or 30-year-olds who come to the swimming pool to practice, or teens who, for example, are in a basketball or handball club. So it's really something that targets people within the club, players, volunteers, coaches, managers, and everyone related to that. So we really see clubs as social venues. Okay, let's take one last question. Sorry, says the speaker. And I'd like to pick up on what you just said. We have a whole range of entities that are part of our network. So when you just referred to clubs, so it can be one sport, single sport, or multi-sport clubs. So what about community centers? For example, could community centers, whether could the manager and the sports officer qualify for this? Yes, well, again, it all depends on where you put the dial. Our tools are based on needs. The diagnosis approach is based on needs. The strategies we have proposed, we do not really dwell on that, but these strategies are designed to manage health promotion projects. It's just that organizations do not use things in the same way. They have their own specificities. So it's really meant to be general in terms of implementation. But, and that's maybe the main boundary of our work, most people come from the community of organized sports. So we can transfer this, but I think we may have to adapt the rhetoric, and it may have to be adapted to other environments. Fabienne. Yes, that would mean less researchers and more people from the field. You just gave an example. Community center, for example. Yes, it's a social venue. So if people go there, they can go there to do sports with a sports educator, for example. Now, the specificity is that just like when they go to a sports club, they come to the community center for supervised, organized sport in an environment where there are people. It's a specific setting. So I think it could work out. I think our tools can work in reference to what you just mentioned. Thank you very much. And I'd like to thank all our speakers. And I'm going to hand over to Anne Villemain, who's going to make the concluding remarks.
Merci.
Thank you. Thank you to all speakers and for giving me the opportunity to wrap up this session that was very fruitful. Thank you to Santé Publique France for giving me the opportunity to organize this session. I was asked to have a twofold kind of conclusion because I'm actually president of Rencontre Santé Publique, but also I'm an executive of Université Côte d'Azur. If I start with my function as part of the Rencontre Santé Publique, I would like to pick up on what was said earlier and talk about commercial determinants of health that was set out in a report. That's what actually determines the products and practices that will have an impact on health. And it's more and more obvious that the activities of this commercial sector have a detrimental impact on health. They would encourage some detrimental products such as alcohol, tobacco, and they would use different tactical methods so as to be a hurdle to public policies to promote health and improve health. Needless to say that actually this serves disparities and inequalities when we address health issues. And we also know that despite, well, in France, we are often known for the even Dievin law, but we are also forbidden to sell alcohol in stadiums, but we also know that there are waivers, that there are exemptions. And we also know that for marketing purposes, there's a lot of incentive. And we often use sports to promote products. And there was a publication in 2018, a fact that occurred during UEFA Champions competition when related to alcohol. And we can see that this lever is used by the industry. I'm not talking about tobacco industry, but also there are other examples that we could give. So it is important to remind this. All this, these are behavioral risk factors: alcohol, tobacco, food, anything that is unhealthy, the sedentarity as well. And the difference is that we have industries between the underpinning the food industry. When we practice activity, we can say that's less linked, even if we can talk about screens and technology. This allows us to do something else. And it's not the same issue as with other industries. However, tobacco, alcohol, and food industries use sports to promote their own products. And so we are in a situation which is even more complex because we have no economic levels. Even though the sports and business is important, we have this idea that physical activity should promote health, and how we could involve public authorities in this momentum, and how could we have an investment in resources and gives the means to policies that were announced. My responsibility as officer of Société Santé Publique France is the transferability of knowledge. And the project and the topic that was tackled today shows that we know how to manage to work with academics, ministries, and public service agents to move forward, to make progress in actions that are scientifically obvious. And with Rencontre de Santé Publique, we try to assist this transfer of knowledge. We also have developed with other partners a portal called Capitalisation des expériences pour la promotion de la santé, which means to capitalize knowledge on health promotion activities. And this encapsulates all the activities that were introduced and presented to you. So that helps us to transition to the other academic responsibility that I have. As an academic, I always thought that I always tried to do things that were in the interest of grassroots activities to transform things. It's not always easy, but the issue that was introduced to you, that was presented to you, and especially the process approach, and it is in this project that I involved myself with my colleagues. I thought that I think this is a collaborative project with universities, with Santé Publique France, with the Ministry for Sport, Olympic Games and Paralympic Games. It is important for us to all work together. We have wonderful examples at the European level of works that were led in collaboration with institutions and academics, public authorities and universities, and we see that it is interesting, important to work together on these subjects. It is also an interesting project because we go from from the local level to international level, and that is important for the World Organization on the role of health. It's important to broadcast, to convey this message, to see how we can publish manuals and guides and actually Santé Publique France translated this into French because we wanted to disseminate it to everyone in France. It's interesting to see how we managed to integrate all these elements all these projects that are done at the international level, but to try to then personalize them, to customize them. And I thank what has been done as a leader by my colleague, because she has worked on the continuation of this project, because we've been working for some years on this project together. And this allowed us to produce and train young researchers, because we've already had 2 theses that were presented. One of them worked on the theoretical part of the model, which was quite difficult. Benjamin Tézieux, whom you have heard, worked more on the intervention. Kevin Barros, who's not here today, has contributed by working on coaches and trainers, and maybe there will be a 4th thesis, we'll see, and a 4th PhD thesis. That's part and parcel of research with researchers, and they are all connected to grassroots activities. And I would like to pay tribute to the work of the follow-up coordination committee that allowed to have a trickle-down effect as to the information, and with a top-down approach. Sometimes academics don't always have a strong connection with the reality, and that helped them. And it's good to have this double perspective. I think this was what was most important. If I should go back to my dual responsibilities, because when I'm at the Société Française de Santé Publique, often the project is the same. I've been working in the promotion of public health for in a significant manner. I thought that it was an important venue for interface, for working with a lot of partners. It is cross-cutting in its approach. Anyone wanting to contribute can contribute. We don't need to be an expert. We work with other partners, and this is why Santé Publique is so important. I'm not a doctor myself, however, I'm president of the Société Française de Santé Publique, because we want to show that in terms of public health, everyone has a say, with different perspectives from different stakeholders, and this is why the task is quite daunting, but it's still very interesting. I think that the crossroads of these 2 hats, these 2 responsibilities, is to work with policymakers, grassroots agents, academics, and together we will be able to move forward. This year, today, it's a major national cause for physical activity, and I would like to pay tribute to Santé Publique France, which has received the accreditation. But I would like to highlight the interest of public authorities for the promotion of physical activity. I hope it won't be a flash in the pan, and that it will be sustainable after the Olympic Games. And hopefully there will be an organization that will be created for a sustainable, viable, long-term existence. The Olympic Games and Paralympic Games should be a driver to momentum, to dynamism, to show that this subject is a cross-cutting issue that could be integrated in any kind of policy, like health should be integrated in any policy. It's important to remind it. Physical activity, hopefully, will be part and parcel of the next major national cause, because it will deal with mental health. And we know that physical activity has an impact on mental health, even though it's no longer a national major cause. Thank you for your participation and your attention. Thank you, Anne. Thank you for these conclusions. I would like to thank you for being here, for staying. We are available if you have any questions. I would like to thank the speakers and my colleagues that came from further away to share their experience. And I hope that you will have a wonderful evening, and I hope to see you again very soon. Thank you.